meaningful involvement of people living with HIV in just strategies of ensuring that who are newly testing for HIV are able to access care and treatment. This project is in Nairobi, in the eastern side of Nairobi. That's the map of Nairobi. We are in the northern side, just for clarity's sake. The project is a youth and general population, HIV prevention for youth and general population. Now, because of the evidence that treatment as prevention has efficacy of up to 96%, it becomes very important to ensure that all clients who are tested for HIV access treatment and care and treatment. And one of the challenges we've had was linking clients from mobile outreaches. That is, we set up a tent on a roadside and then clients come and access HTC. How do you make sure that this client actually goes to a health facility and you have proof that they went? And that was important for us also because most of the clients we test, 83% of them are tested at mobile outreaches. Now in the year 2010-2011, we used this model where the client will be tested in the HTC room by a counselor, and then the counselor would refer this client with a referral coupon, the traditional way we've always done, to a health facility and track those coupons at the end of the month, and then also refer the clients to psychosocial support groups. And then in the process, if they discover that the clients did not access the service, they're able to follow up through a phone call and just be able to encourage them to test. The model, however, was not very successful. At the end of the year, we only had proof that 4% of those clients had actually accessed care. Those are the ones we had proof they had accessed. So we introduced what you can see in red, a link person. Now, a link person is somebody living with HIV who is living positively. By introducing the link person, their role was the counselor will test the client and then ask the client for their consent to be able to introduce them to a person who is best at that site, who is just outside the room, to be able to escort them to a health facility as opposed to sending them there. So this, if the client accepted, and most of them do, this person will link them. And if the client refuses, then the counselor will have to fall back to the other normal strategy of doing this. The other processes, again, stayed the same. Now, when we changed this, the first result in the first quarter, you can see 4%. That was a trend. We began to see an upward trend immediately, as you can see from that. What you see in white are the denominator is the number of people who tested positive, and the numerator are those who were effectively linked. You can see the same result by the different districts where we were working. You can see the upward trend. And then you can see that by static standalone HTC sites and mobile outreaches, again an upward trend. And we also realized that the quality of post-test counseling could be playing a factor in that effective linkage. So we began to track this by the counselor who tested the client. And we realized that some counselors were actually having 0 linkage, others were having as high as 73. But because we did this more recently, we are working on helping the quality of post-test counseling. We'll be able to track this later on. And this picture, you can see the colored jacket, the lady in the colored jacket is a link person. She's been living with HIV for about 15 years. And then the one in the black suit is a counselor. And they are having a session with some of the people that they had linked. They have formed a support group. The challenges we had with this model was, one of them is the working hours. The fact that the mobile outreaches, most clients come there after working hours when the facilities are closed. And then, of course, some of the clinics enroll clients only once a week, meaning that if you test a client on Monday, you may have to wait until the following Monday, maybe the following Tuesday, Saturday or Monday rather, to be able to link this client. And then we also have the issue of some clients who also already know their status when they're coming to test, but they're being prayed for. And the challenge with this is the fact that they're usually told not to take their medication, which means it affects also the treatment issue. And then we have, because we are based in the city, many clients who come on transit, they're just visiting relatives, so they travel up country soon after they test. And then finally, for the lessons we've learned, that it is teamwork. The whole spectrum of the service providers, from the HTC counselor to the link person to even the services they receive at the facility are very core in ensuring that this works. And then the lead person needs to be a role model, should be somebody who is adhering to their medication, because it is what they tell the client as they walk with them to the facility that really also reinforces the message. And then, of course, what we've also realized is that when clients are linked on the same day that they test, it is much more effective than when you wait for a week. Thank you.